Africa today is at the Kanifing General Hospital, formerly Serekunda General Hospital, with special focus on preparedness of the facility to tackle cases of the coronavirus. Women groups in the area have decided to support the hospital with sanitary material as part of their contributions to development of the second biggest medical center in the country. Ibrahim Abba is on the hospital ground, not on medical admission, but on medical observation for the Good Morning Africa program. Well, thank you very much, Ibrahima, and thank you for joining us. Very happy that you are, of course, on observation. How prepared is the Kanifing General Hospital in the wake of the COVID-19?
On this ground, which is the largest medical facility in the country, is definitely part of the show in the wake of COVID-19. So right at the gate, the Kanifing General Hospital, which was formerly called Serekunda General Hospital, has some measures in place which are very noticeable. Yeah, the hand washing is highly enforced, and some screenings, according to the WHO measures, are all implemented. That is, having some temperature check and some questions one has to answer before getting access to the ground is all enforced. And now this is not a treatment center, it is a hospital, and then that is prepared to be a holding center for any possible case of COVID-19 before they are on ward transmission or for transfer to the treatment center, which is the sanatorium in Banjul. So this place is definitely has a large catchment area, meaning that all the facilities and the preparedness is to be enforced on this hospital here.
All right. Now, what support is coming from the women in the area to the hospital?
We understand this morning, women groups within the Kanifing municipality, the host of the hospital, are also bringing up some support initiative to the hospital. That is a part of their contribution to fight the COVID-19. The hospital being this large, and the catchment is large, so they would always say that the hospital needs the collaboration of the community. And now you have women groups who are living within the community here to gather up some funds, and then we know they are bringing up sanitizers and then detergents, things that are definitely necessary for the Kanifing hospital to use. Even all corners or all Johnsons within the hospitals, in all wards, you have hand wash basin, and the ministry will always say that there are a lot already, but this is what we understand on this ground, that it can never be enough. So one of the officials we spoke to earlier on the ground said to us that there is no country that has enough material. So having donation coming out from the members of the community, it will be highly welcome. And the presentation of that initiative will take place by 10 o'clock. That is in the next 1 hour.
All right. Now, have you tried to talk to any of the staffs in the Kanifing municipal, of course, Kanifing hospital rather, for official details about the COVID-19 or work at the hospital at the moment?
Yeah, we have a staff. Today we will be talking with the hospital administrator, who will give us some details, because knowing that COVID-19 is now discovered in the country, what does this mean to the traffic of the hospital in terms of admission of patients? Has there been any change? So there is where I will welcome Babukar Sen, who is the hospital administrator.
All right, thank you very much for having me. Good morning, viewers. My name is Babukar Sen. I am the administrator of Kanifing General Hospital. So with regards to your question, I just want to say that well before the Gambia recorded its first case of COVID-19, this hospital has been preparing itself, knowing fully well that we are strategically located and we're serving a huge catchment area of about 600,000 inhabitants. When we recorded the case, what we did was, as an institution, is to put in place some institutional arrangements. Key among them is to make sure that all our clinicians are trained on the case management and also on infection prevention and control to prepare them on this COVID-19, so that they know what this is all about, its mode of transmission, how they can protect the community and how they can protect themselves. So our doctors, our nurses, our lab technicians, and our support staff, even the athletes, the security, are well informed and well trained about COVID-19. Secondly, also, we have installed what we call hand washing stations. If you look at them, they are distributed everywhere in this hospital. And we have ensured that visitors, patients, and also staff wash their hands regularly and scrupulously. And now, before you enter our hospital, we make sure that you are screened. What we do is that we use the infrared thermometers to check your temperature. If your temperature is very high, we will also ask you some questions, like whether you have travel history or whether you have come in contact with somebody who recently traveled to certain hotspots around the world. We also ask you whether you have sore throat, dry cough, difficulty in breathing. Now, if you answer yes to all these questions, it's very simple. We'll just isolate you, give you a mask, give you hand sanitizer, and then we send you to an isolation unit. The same thing, a team will come and also give you some psychosocial support. Well, it's not just enough to just isolate somebody like that. You have to explain to the person what is going on. Otherwise, they will have this fear factor. So that is also another measure that we did.
Looking at the wards, we know there are patients admitted right now. So what measure is being in place to ensure the spacing, the social distance?
That is very, very important. Actually, what we have even done before talking about the admission wards is to scale down on our operations. Now we are just operating at an essential level, meaning that we're attending to emergencies and certain conditions that cannot wait for long. So what we have done is that we have canceled all the elective operations that are the planned operations. We have also made sure that we give patients coming to our clinics long appointments so that they don't have to be meeting here all the time and be overcrowded here. And if you look at all our clinics now, we make sure that at least there is 1 meter spacing between patients to make sure that they are not overcrowded. In the wards also is the same thing. So by and large, we have really scaled down on non-essential services and focus only on essential services. And this has allowed us to reduce or limit the number of patients that are coming into the hospital. And by so doing, we are now able to make sure that there is social distancing and there is space between patients.
It has also been insinuated that the number of patients is dropping down simply because there is stigma associated with coming to the hospital in the wake of coronavirus. Is that also substantial here?
Well, yes. The number of patients coming to our hospitals have reduced. It's not only this hospital, it's nationwide. But I don't want people to stigmatize COVID-19. It's a disease like any other disease. And it doesn't mean that anybody that has COVID-19. We have to be very careful about that. Well, this was a problem that we had with tuberculosis. This is a problem we have with HIV. So we don't want anybody to stigmatize COVID-19. Okay? And what is important is that if you have the signs and symptoms of COVID-19, which is fever, dry cough, sore throat, difficulty in breathing, call 1025. Okay, and once you call that, we will come and support you, and all the treatment that you need, all the support you need, we make sure is provided. But let people not stigmatize COVID-19. Okay, the reason why numbers are dropping, we are not sure, but we want to believe that there is this fear that if I come to the hospital, they will diagnose me with COVID-19. No. Okay, if you have an urgent case, if you have you are very, very sick, come to the hospital, and seek treatment. Our hospitals are open. We operate 24 hours, okay? But if you have those signs and symptoms of COVID-19, call 1025. So we don't want people to stay at home until it is too late. Then they rush to the hospital. Then it will be very difficult to help them. And let no one stigmatize COVID-19.
We also know that this is not a treatment center.
Yes.
The treatment center is at Sanatorium, RVTH, near Banjul. How long do you have to hold cases here? Or in fact, how prepared is this center to hold cases? How many cases could you hold for a while and how long?
Okay, that's a very good question. I have said this thing earlier, that this particular institution, long before Gambia recorded its first case, and long before the WHO declared COVID-19 as a public health emergency of international concern, we started preparing. We started preparing a long time ago. And we did that by training our doctors, training our nurses, our lab, even our support staff, the orderlies, we trained them. We also make sure that we secured enough PPEs. Those are the personal protective equipment. We also make sure that the hand washing stations are everywhere. And we also made sure that anyone coming into our hospital is properly screened. So these are measures that we have put in place to make sure that we are well prepared. Now, your question about holding area. Yes, we are not a treatment center. The treatment center is in sanatorium. Okay. However, we have a facility where we can keep suspected cases. That is those who meet the case definition. I have mentioned that thing earlier, the fever, the dry cough, difficulty in breathing, and the sore throat. So what we do is that if you have all those classical signs and symptoms, we give you a mask to put on to prevent you spreading the virus further. We give you hand sanitizer to sanitize your hands. Then you will go with the nursing staff, you'll be isolated. It's a well-built, well-equipped and well-resourced facility within the hospital. Now you'll be there and we will call, there's a mobile team that comes and collect your sample. So they will collect your sample and send it to MRC. Currently it's only MRC that is doing these tests. So it takes about 24 to 48 hours for the results to be out. So if you are negative, we will further cancel you and ask you to go home and self-isolate for another 14 days. Okay, and we will also be monitoring you because in this hospital we also have our task force that is responsible for coordinating the preparedness and response to COVID-19. If it is positive, we will call the Ministry of Health, the EDC, they will come and collect that patient and take the person to the sanatorium.
Just lastly, we know there are women coming to give some donation support to the health center. What does this mean to the hospital, of course? What does this mean to the SK hospital?
Wonderful. That's a good question. It means a lot to us. Remember, I've been saying this thing, COVID-19 is bigger than any country. Yes, what is being given are sanitary materials, bleach, soap, detergents, Dettol, you name it. So they are bringing this thing to help us in our response, in our fight towards COVID-19. As you can see that the hand washing stations are there. In any bucket, we put bleach there, we put detergents. And it's very difficult for a hospital like this to sustain that because we don't know how soon COVID-19 is going. So what this thing means to us is a lot. Secondly, also, it also means that the fight against COVID-19 should not be left in the hands of the Ministry of Health. The community has a very important role to play in the fight against COVID-19. In fact, we are here to serve the community. So it requires the collaboration between the community, between our institutions, between the government, the private sector, and NGOs for us to fight together. All hands must be on deck to beat coronavirus in the Gambia. Thank you very much for having me.
That was Babukar Sen, administrator of Serekunda, or now Kanifing General Hospital, speaking to us to clear some of the areas that we needed a lot of clarifications. And Amadou.
All right, thank you very much for your time. It was indeed a pleasure having you and of course having those clarifications done by the health official. Thanks for your time.
You're welcome.
Thank you very much. That's our very own Ibrahim Presba, senior editor and correspondent, speaking to us live from the Kanifing General Hospital, formerly of Serekunda, as you have just mentioned. Well, press mu doon wax ak ñi nga xamante ne ñoom ñoo ŋànk hôpital boobu foofu ci Kanifing mu nekk l'hôpital bu mag te ñu bari ñu fay dem waaye jamono ji taxawaay bi ak li nga xamante ne mooy naka la ñu mën a diilee ak coronavirus bi dégg nañ leeral yiñ ci indi mu nekk lu am solo te kim doon waxal nee na daal li nga xamante ne mooy ñoom yàgg nañoo waajal seen bopp pour dekku li nga xamante ne mooy cases yi in case bu fekkee ne am na ki ko am ci hôpital bi waaye nag ñoom foofu duñ ko faj ak yooyu mu nekk lu am solo te jigéen ñu dekkee tamit ci gox bi ñu gis ne tamit ñu ngi ñëw booloo dem yóbbu ay ndimbal ci hôpital bi loolu yëpp mu nekk li nga xamante ne mooy initiative yu rafet.
waaw am na solo bu baax Amadou comme ni ko presse doon waxtaanee ak Mr Sène wax na yu am solo waaye li ma si gën a lifin mooy comme nit ñi dañ am rôle bu rëy pour play ko si this coronavirus. waaw mooy jéem a naka la ànd ak sarta yi. ba pare itam di ko jéem a diglante si seen biir because nit ñi suñ ko gëmul rek wala pléwuñ si rôle buñ si war a play rek dafa ñëw nekk problème ëllëg si réew mi fii. te moo tax am na si solo because yow ba léegi sax xam nga lu ma la wax ba léegi am na ñooy dem ba léegi. lii waxi ngelaw leen ko def soo moo tax comme mu waxee ne community am nañ a big role pour ñu play ko si am na solo. am nañ si they are very important tam
ci taxawaay bi gis nga distancing bi xëj na moo tax ñu taxawee nii bii yëpp si hôpital bi gis nga ku xam daal da nga gis ne ci am na ci biir waaw te lii yëpp xëj na waajal li taxawaay bi ci coronavirus bi moom moo ko waral
lopitaan nit dafa war a nekk exemple moom si leen war a jëlee exemple si dem jëfandikoo ko si kër yi jëfandikoo ko si penc yi jëfandikoo ko si mbedda yi sa in fact waaye ñoom suñu gisee ne ñoom defuñ taxawaay boobu tam nit ñi dafa doy waaye ñoom ne leen jaajëfal bu baax si taxawaay bi am na solo parce que lopitaan bi naa gis nga mu ngi seet ba pare mu ngi laa woon ne koona bu nekk am na foo mun a dem raxas sa loxo yi am na fa so loolu yëpp am na njëriñ bu baax waaye di dellu rek si nit ñi dañ si am solo bu baax a baax di gën a ñaa askan bi rek ñu gën a bàyyi seen xel si lii parce que mooy lépp ba pare itam gën a topp ak ndigle docteur because loolu rek moo fi sës léegi loolu rek moo fi sës the only thing loo xam ne suñ ko jëfandikoo rek mun na am yàlla dinañu si musal waaw te itam def si seen may ni ne feebar bi tam mu ngi fi because am na si nga xam ne susti si réew mi fi amoon may ni garaawoon fi
waaw exactly loolu lu am solo julde ci ñaari yëf xam naa dañ koy tënk rek waaye benn bi mooy dégg nañ muy wax stigmatisation nit ñi li ko waral mooy ñu bari jamono ji wàññi nañ dem hôpital nekkul ci hôpital boobu rek waaye ci yeneen hôpital gis ne nit ñi nu ñu doon demee faju ji wàññeeku na bu baax a baax bu coronavirus bi ñëwee ba léegi boobu benn la beneen bi tamit taxawaay jigéen ñi ñu dekkee ci gox bi ñëw dajaloo am ndimbal bu ñu dajaloo yóbbul ko ci hôpital bi dafa mel ni ñoom tamit ñu ngee bàyyi xel taxawaay hôpital bi conscience si tamit ñëpp di woote ñu ñëw ñu def ci seen loxo foog naa ne loolu tamit lu am solo la ci ñaari yooyu
dafa am solo Amadou man sax foofu laa bëgg a ñëwee woon in the area of the stigmatization because nu mu ko waxee moo nekk ne the numbers are dropping because people are not going to the hospitals with the fear and coming guy they will be stigmatized so I think that is really serious because who knows maybe nit mun naa am coronavirus mu toog si kër bi mu ne su ma demee hospital mun naa am dinañ wax ne coronavirus la am te nit ñi dinañ ma stigmatize so that is I think it is doing more harm than good because at the end of the day yow soo demutee si lopitaan gi nga xam your condition mun ngaa infect so many other people so what is happening to our country so it is serious comme nu nga ko waxee rek coronavirus is like any other disease nit ñi dañ ko war a xamee noonu moom tamit dafa ñëw as any other disease like HIV
in as much as ni amagul garab waaye tamit bu la téyee mun nañ laa faj nga wér
exactly
après ça daguma la coronavirus dafa xala ñuroo tam si soj yi fi am ak yooyu noonu bu ko mu ngi la wax ne soo amee sol tramo wala ak soj ak yooyu kon loolu complexe nekku fa
exactly so I think dafa important torop pour stigmatisation bi buñ ko fa def gis nañ fi HIV is so many people ñu leen stigmatize and all but at the end of the day yow da nga war a xam ne yow sa health bi moo gën a important what the people are saying because yow not only you at the end of the day waaye da ngaa mën a infect your loved one and your family members your relatives and neighbors so loolu noonu dafa andi it will do more good than more bad than good secondly fu mu waxee ne ñoom the efforts the hospital has been doing to make sure ne ñoom ñu cope this prior to the announcement by the WHO and even before the first case in the country so I think that is very important all hospitals needs to follow suit in that regard to make sure ne xam nga ñu mun a cope the COVID-19 pandemic
all right su ko defee mu ngi noonu waaw kon dafa mel ni dañooy dellu ci Kanifing General Hospital bi ñi nga xamante ñoo yóbbu ndimbal bi foofu presse waa dafa war a wax ak ñoom ñu dem ci hospital bi well of course press well I did say fresh it should be press yes but I hope he is very much fresh of course yes what more can you have to what do you have for us I understand you should be talking to the donors.
Yeah, Amadou, the women group are here now. So I guess I have the PRO and the one acting president of the group. So I'll just send the mic straight to the PRO to introduce herself and to the association and the activity tonight. Yes, welcome.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Aminata Jaita. I'm the PRO of the Nyunenla Association of Kanifing Estate, under the leadership of Sarah Goda Juf. This is the association. And our objective mainly is primarily to empower families and, communities. So that said, we are into a lot of activities at the grassroots level. But if you ask me the objective of this particular event, We're here basically to complement the efforts of the government and that of the First Lady by extension. And there's a common saying that ask not what your country can do for you, but what can you do for your country? So as a women's group, we feel it is an honor on us to contribute our quota. It might not be much, but it's significant. It's a kind of symbolic to show the whole country that, yes, we expect a lot from the government. The government should do a lot for us. But also as citizens, I think we all have a part to play. And this is why this association take it upon ourselves that during these trying moments, we should contribute our quota, by, coming up with sanitary items for the hospital. And if you ask me why the Kanifing Hospital, they say charity begins at home. If we're able to do it, we would move to other hospitals. But yes, we are starting with the Kanifing Hospital.
That was the PRO, and now I will just turn attention to the president of the association. Okay, the assistant secretary, who want to throw some words. Munga nyawlegi introduce new suburb.
In any language?
You want to speak English? Yeah.
Okay. Good morning. My name is Mrs. Harriet Damfa. I'm a member of this Nyunenenla Association from Kanifing Estate. Okay. We feel it's our duty because, as we always say, the government cannot do it alone. We feel it's our duty to also to contribute. And this hospital, we say, is us because it's situated right at Kanifing Estate at the layout. So we feel we should do something for the hospital. So as this COVID-19 is on, we feel that we should bring sanitary materials to help to ease the problem of this washing hands and washing blankets, bed sheets and the like. Yeah.
That's very interesting. And what you say is very clear. But dama bëggoon rek nga translator ma loolu si wolof pour ñuy déglu tamit mun ko understand si within the community.
Okay.
Lu leen tax ñëw fii de.
Okay, asalaamaaleykum mbokk yi. Maa ngi nuyu ku nekk ci sa tur ci sa sant di ko dooree ci suñ président wàcca ba ci suñ ministre bu baax bi because moom itam mu ngi ci suñ gannaaw. Léegi ñun waa Kanifing Estate suñ compagnie bi mu ngi tudda ñu ni neen la. Man maa ngi tudda Arrête Damfa assistant secretary. So dañ ñëw fii tey pour dimbale lopitaan bi dugal suñ loxo ci ndimbal bi nguur gi defal suñ réew mi. Kanifing lopitaan bii nii ñu tuddee Serekunda hospital ñun dañ feel ne suñ bos la because Gambia yëpp ñoo ko moom wante Kanifing la nekk Kanifing Estate. So dañ feel despite am na sponsors dañ feel ne ñun dañ war a def suñu waala dégg la doole amut wante xol bi rëy na léegi moo tax ñu feel ne nañ dajaloo seet luñ mun a defal suñ lopitaan ci yëfi COVID-19 bi su ko defee dina mun a dimbale leen tuuti du dem lu bari nag wante dina tane moo tax ñu ne nañ dem jëndi bagage yi fóot bagage yi raxasukaay bagage yi setal nga xam ne dina mun di fóot seen darab yi dina mun di fóot mbaaja yi dinañ raxas wanak yeeg lu nekk moo tax ñun jënduñ paan ñu ne nañ jënda bagage yi setal rek.
Léegi yéen seen association bi ban pexe ngeen tegoon pour mun a am lii bagage yi bu ngeen a indi tey fii.
Pexe biñ def mooy ñun dañ sànniyante loxo biñ toogee seet lii ñu ne accaleen ñu sànniyante loxo dégg nga suñ sànniyante loxo dinañ mun a am luñ fi indi weer dëgg la weer wu nekkat dañ dee dajee ñuy tekk dégg nga wante xeeb nañ ko ñu sànniyante loxo dooleyante ca lañ am ñu mun a jënda yi leen jënda ni indi fii tey waaw jërëjëf.
So, Amaru, that was the Deputy Secretary General of the Union Association in Kanifing. Union Association. So, please just certify me. So, yeah, and we already heard from the PRO already. So, these are the passionate people about the hospital. They said it is located in their community. So, it is their hospital. They need to come and help. And that is the activity that is going to take place shortly. The Honorable Minister is expected to be here to grace the occasion, and then formally it will take start. The event will kickstart anytime, in the next few minutes.
Wow, kon jërëjëf waaye ñu neel la nag waroon nañu bàyyi nga tàggatoo ci olof bi waaye jërëjëf suñ boss la duñ ko tooñ Press, thank you very much. We will leave it at that. waaw am na solo ñu ni neen la te foog naa ne lu am solo la li leen boole ba ñu xalaatee noonu loolu moo waral ñu dem comme suñ maire boobu nuñ ko waxee ñu xeeb nañ ko waaye li ndaw luñ def dana am fi nga xamante ne foofu laay fat te loolu dafay am solo bu baax a baax ci taxawaay bi comme ni nga déggee ñu wax ko ñu nekk lu am solo te jàpp naa ne ñeneen tamit war nañ cee mun a roy waaye li ci gën a spécial mooy ñoom ci dañ dekk ci gox bi gis seen bopp ci hôpital war a ñoo xaal xëy na keneen jiitu leen ci loolu
interesting ba pare sa amul lu ko olof yi di waxee rek kuy raam di la boot su amee moto du la fa bàyyi nekk na lu am solo ba pare ñunu neen la loolu réew mi yëpp la sax association bi moo ko tudd ba réew mi Gambie yëpp ñunu neen la soo moo tax tur bu am solo la xam naa presse dinaa ko seen Saalum mu dem ci ëpp Saalum fële laa ko yóbbu nag njaaw mu dem gars yi lifin ko mu gën a yokk olof bi foofu noonu waaw moom tam mu yokkal ñi fii yeneen bagage yi mu amee am na solo bu baax waaye Amadou c'est right moment right now ñu gis ne ana yaayi compagnie ñoom itam war nañ génn si because su time politique jotee ñoom ñëpp ñu solu yëngat seen gars yi askan boobule tey moo soxla ndimbal kon
nii la ñoo dem seeti ñoom
ñii la ñoo dem seeti te nag right time la ñoom itam pour ñu génn si jàppale askan boobu nga xam ne buñ soxlaa mbiti ñooñu la ñoo oo ñu ñëw kon nag time la pour ñooñu itam
jërëjëf waaw Julde just quickly ñu balaa ñoo xuus si lan nga mën a ene jàngat ci di nga taxawaay bi mu nekk lu am solo te ay jigéen lañ ay nekk tamit ay mag responsible waaye ñu am taxawaay bu mel ni
Leader, it's not a surprise. Women are always in the forefront of development. It's not a surprise that women are really coming forward to donate to the Kanifing General Hospital. It's a laudable initiative. I'm not surprised. The women also will be in this fight against COVID-19, and I am sure we will expect more of this because jigéen yi daal ñu ngi daan seen doole to make sure whatever situation arise ñoom tamit dañoo nekk in the forefront pour dimbale so this is very good pour dañ gis seen boppa ne ñoom ñoo ko moom they take ownership of the initiative xaaruñ kenn benn donor or philanthropist mu ñëw pour dimbale gaay ñoom ñoo ñaxtu come together ñu add luñ mun a am rek ñu yóbbu ko si hospital bi ndimbal bi because Kanifing General Hospital dëgg la si Kanifing la situated but it's not only people residents in the Kanifing that are going to that hospital am na ko mun a jógee Brikama sa nga war a dem Kanifing so this is really good